Welcome back. We have today the honor of having Dr. Paul Dominique. He's he has a foot in each world. He's part US and part European, so that's why we like to have his perspective. First of all, Dr. Dominique, would you like to introduce yourself, please?
Yes, hi. Good to be with you, Dr. Bach. I'm Paul Dominique. I'm a pediatric dentist. As Dr. Bach alluded to, I live part of the year in the US and part of the year in Europe. So I do have a global perspective where I think the dental industry is heading, especially post this COVID-19 crisis.
How this crisis affected you, Doc, on both sides of the borders?
Well, first of all, I think, COVID-19, it's a healthcare crisis. And I think it's a wake-up call for healthcare in general. But what's really the most fascinating thing about COVID-19 is it's precipitating an economic crisis. And I really feel the build-up to this economic crisis was occurring before COVID-19. I think COVID-19 is just basically the pin that burst the bubble. I feel that, globally, we have gotten into a lot of debt. Financially, the world has taken up too much debt. There's a lot of sovereign debt, a lot of corporate debt, student loan debt, and consumer debt. And I think the pause that we are seeing in the economy, we are seeing this debt, this a lot, has come to bite us. And I think going forward, things have to change in the economy and how the world is structured going forward.
But actually, I'm sorry to go on the other angle, but right now the solution is for most of us to get into more debt to get out of this.
Correct. But I guess, and that is going to happen. I mean, we're seeing, central banks all over the world print money in colossal quantities that we have never seen before. It's unprecedented. I mean, here in the United States, I believe it was on Thursday, the Fed said they were even going to consider, junk bonds. And I mean, 5 months ago, I don't think anybody would have believed that was likely to happen. But we're seeing it now. We're seeing just things that we would have thought just so far out happen now. And yes, it's gonna struggle. We're going to struggle with this debt for some time to come. But what we're just creating down the road, unless we change, things, is we're just inflating larger and larger bubbles. It's like almost we have learned nothing from the last financial crisis.
And how is it? Is it the same in Spain, or is it worse over there?
I think it's a bit worse. I do. I think it's here in the United States.
So if we're back to dental industry, how do you think this will affect us?
Well, I think it's going to affect the economy, so it's going to affect the definitely the flow of patients coming into dental practice, what they're going to want, as far as treatment. It's going to affect how we. I mean, I think the consequences are far-reaching.
And are you talking for both sides of the ocean, either Europe and America?
Yes, I mean, I know more about dentistry in the United States. I've never practiced as a dentist in Europe. I'm more familiar with the US side of dentistry. I'm a former owner of 4 pediatric dental practices. I was actually in public health and academia. I was an assistant professor at University of Dentistry right after I finished my general practice residency. So I'm used to seeing dentistry from from the pediatric, from the public health side. It's alive and well. It's flourishing, especially in rural communities where lots of patients don't have access. And I think if we're not careful in the post-COVID-19 world, we could end up, losing those patients. And it's going to put a tremendous burden on the healthcare system, going down the road, which is why, I want to talk to you more about dentistry. As we've talked before, I'm an investor in a teledentistry company. It's the first, what I would call the first comprehensive telehealthcare company exclusively for dentistry in the United States. I think that's the future.
When you say it's a future, what do you still have to do to make it mainstream? Is it the technical side or is it the legal side?
Both the technical side and the legal side. From the legal side, we have the dental boards. They're not wanting to really get on board with teledentistry, for various reasons. From the technical side, yes, it definitely does have to improve. It's not, but this is the only solution for basically bringing care to the masses.
Because I was exchanging with a lot of doctors lately, and we're all thinking of, is there a way for us to keep serving the population while we're in pause, and to keep acting as doctors in the dental field? And teledentistry was one of the solution that we can apply right away. So I know you won't say it on screen, but I have to push. I think that this can be a limited remedy for what we're facing right now. Can we have teledentistry active within let's say that we cut through all the red tapes? Can that be a possibility within the next few days?
Not in the next few days. It definitely does need some advancements in technology. I mean, the ultimate goal,
Oh, I'm losing the.
And we don't think both. I'm sorry?
Yeah, we got cut. Can you just repeat the answer, please?
Oh, yeah. I think if we need to, I know this has become a cliche, but we need to, in dentistry, we need to have this moonshot. Because if we don't, we're going to leave a lot of patients behind. And I fear that medicine will come and can take dentistry. But literally, I mean, when you look at, from a disease model of what dental caries is, I mean, dental caries is a metabolic disease. It's just like any other metabolic disease, like heart disease and diabetes that, we humans suffer from. Dental caries is mediated by bacteria that live in the plaque. And through telehealth, we have the ability to manage that very effectively through frequent examination, rather than constantly bringing patients into the office. I think, the goal would be to have, some kind of imaging stations at strategic locations in very, in areas of high foot traffic. These could be like in pharmacies, where we get high quality images of patients' mouth. We can use this closing solution to basically reveal the plaque. And it's just through managing this biofilm is how we can really eradicate this disease, particularly in rural communities.
So you think you're talking about something way broader than just for us to have a tool to work. It's mainly a way to improve the health of the population.
Yes, because, prevention, an ounce of prevention is worth a pound of cure. There's a lot of truth in that. And I think we can leverage the power of teledentistry through frequent examination, through multiplying the effects of dentists to really, really prevent dental care, to prevent, restorative dental care, to really put the brakes on it. And I think definitely that's where teledentistry, the future of teledentistry is through management of the biofilm.
And
I mean, it's going to rely more on hygienists as well. I think we're going to have to, like you guys have in Canada, I think we're going to basically ultimately have to allow more independent practices of hygienists. I mean, we have this professional that trains 2 years beyond college. They're very knowledgeable. And like I told you the other day when we talked on the phone, it's like, we have a Ferrari and we're driving it like a Fiat. We need to let them, yeah, it's true. We need to let them loose on the public, for lack of a, just to be blunt, and let them go out there with the tool of teledentistry. And basically, this is how I believe we can really do a lot of preventative and reduce the need for restorative dentistry in society. I think this is
I'm gonna lie here because usually I think that what you're saying is there's a lot of things you want to change, and some people will not always agree with that change. But right now, we're all on the same page. So if I'm asking you in the name of our industry, what kind of red tape did you encounter, and how can we help you to bring this tool to life as soon as possible so we can start resuming our into a new reality? Because from now on, even if the pause it's like it's on pause, what's gonna happen is people will be just afraid of coming back to maybe something that may be safe, may not be safe. So we will need to evolve from here. So how, as the profession of dentists and the whole industry that is now listening, how can we help you to bring those kind of tools online as soon as possible?
Well, I think we need to sit down and have, establish a dialogue. Again, using the phrase a moonshot, we need to sit down and discuss this and be very open and be very uh, realistic and have, a meaningful conversation, because the dental profession, again, being a pediatric dentist, being involved in high volume practices, it's not uncommon in the large pediatric practices that I own and that I now associate with. We see high volumes of patients, some days on 120 patients. That most of that is hygiene. And we're just really, as a profession, I feel we're just at the tip of the iceberg. And we need to leverage the technology to help us serve the masses and help the masses. I think, for humanity, we need to do this. So to answer your question about what do we need to do, we just need to raise awareness. We need to come to the table and talk about these issues. These issues, they're not cheap to solve. We need to talk about, how do we raise funds to implement these ideas. We need to come together and discuss, not really, drop our egos and and see how we go forward from there. But these are very doable situations. Managing plaque is a solution. Cardiologists have told me multiple times they would just love to get into the patient's arteries and clean them out on a regular basis. They can't do that. That's a very invasive process, a very costly and invasive process for them to do. We have the ability to basically remove the plaque from patients. Even if the patient is not compliant, we have the ability to do that. We have the ability to remove the biofilm, to treat the patient without requiring a high degree of compliance. We have the ability to take very high resolution images of patients' teeth before and after this closing solution. We have the ability now, cameras, to get images of the caries progression in teeth without the use of ionizing radiation. So I think going forward is we need to sit down and have a discussion as a profession. We need to bring individuals from outside who have the expertise in raising funds, because ultimately my fear is, yes, I know you're saying about, in the post-COVID-19 world, there's a lot of patients that are not going to want to come into the dental practice. My fear is people have short memories. And a year or two after COVID-19 is faded from our memories, we just go back to the old ways. And the old ways is not sustainable because it's leaving too many patients on the sidelines.
I have to tell you, Doug, I was expecting to talk about to somebody who will be talking about technology and how it can solve this. And you're taking this opportunity and you're addressing needs that usually we overlooked. And for this, I have to tell you the respect I'm having now for your initiative. And also, you were fighting for a mic. Now you have a mic and you're not fighting to prove your work. You're trying to say that this is what we should do. This crisis has brought a lot of people together, and I'm so fortunate and humbled by meeting people like you you are ahead of your time. I have to tell you that you're ahead of your time. You were ahead when you talk about dentistry. Now we at dentistry, and now you're way ahead again. But
Yeah. Well, I
being
don't.
alive, I have to tell you, help us try to catch up to with your thought process. How can we do at this stage that maybe in a week or in a month from now have a tool that might start launch to the dentistry? So whatever you have in mind can have a good base to build on, but also that our dentists and most of the population right now thinking what we should do for the only time in history, they are all listening.
Right. Well, I think for the first time in history with teledentistry, the technology of teledentistry, and giving hygienists the proper legal tools that they need, that we can really go forward and raise a generation of subscribers, patients that want to subscribe to this novel way of dentistry, and raise a generation of subscribers that will never have to have a drill in their mouth. Never hear the noise of a dental drill in their mouth. Never feel that vibration. Never have to feel numb again. I think we have the ability to do that, but we have to come together, and it's a very uncomfortable conversation because a lot of dentists out there, they feel that ultimately this is going to take away what they do for a living. And I don't think so. I think because the world is a big place, and I think as we bring more and more history, I think we're going to start bringing more and more patients out of the woodwork who have existing disease.
So you mentioned here that I like to explore, and we just have a few minutes left. But if I bring you population, because you were talking to dentists, they weren't that open, and we both understand why. Now, if I bring you to a population of hygienists, do you think that you can just unite everybody and to have maybe another crowd supporting your ideas? Is that something that will help you?
Yes, I think it would. I think definitely it would, but it's going to take just more than dialogue. It's going to come, I believe, from people from leaders outside of dentistry to come and help us solve this problem.
What I can tell you at this stage, I have the ears of a lot of people. I am a doctor, but I don't consider myself solely a dentist. But I want to see things move forward. So I'll need your help for the dentistry because I promised my peers to help them. But if you need to advance this cause to the next level, and if you're willing to talk to a portion of hygienists, I'll try to make some phone calls and see how that can turn on. And if that's going to be
sure, absolutely.
We need people, right? At this stage, it's not about power; it's about solution.
Exactly, it's about solution, and it's also about dissolving our egos to come together to serve humanity. And I think there's going to be tremendous opportunity from that, tremendous opportunity to profit from it. I'm not anti-business. My 4 dental practices were very, very profitable. But I just think the world needs a new way now, because there are a lot of patients that are left at the side of the road, and we need to take care of them.
We had a minute left, and I have to do this online because I know that you're a very reserved person. Next Friday, we're gonna have a panel with a lot of big thinker of a profession, and I would love you to join us as a
sure.
Thank you. So now you're stuck with me to discuss dentistry. But in the same time, now that we've connected more and I understand what you're trying to achieve, if you're able to, let me see if I can have other people to listen to this, because you said yourself, the people who's gonna advance dentistry mainly are the physician, because they're gonna accept telemedicine first, and then we're gonna just copy paste from.
Yes.
But
well, I think medicine has already embraced telehealth more than we have in the dental profession, because one of the shortcomings of telemedicine is we literally can't do restorative care as yet, even though you can. I have seen it in Asia. I've seen a dental implant being placed remotely, through a cloud-based platform where the surgeon was not in. I didn't see it live, but I saw a video of it. Um, but I think definitely in prevention and getting patients access to a dentistry in remote areas in the United States and Canada and worldwide, I think this is where teledentistry combined with dental hygiene, I think it is the future to address the needs of these patients. I just think that we need to realize that we can literally raise a generation of patients that will, not need the need for traditional drill and fill dentistry. And I think that should be the goal.
So doctor, this, you know that it's recorded and a lot of people will see this. Let's make a deal.
Mm-hmm.
Help our profession to get out of this crisis.
Right.
And make sure that everybody else will either shut up or support your vision of fairer dentistry, including everyone. But I think at this stage, we still need to address our peers first, because if we don't have our peers on our side, it's going to be hard. But I can make sure that they're going to talk for us, or they're going to either shut up.
Right. Well, I think, talking to the peers is very important, because, we do need the help of dentists to bring these novel ideas into existence. But we also need to talk to the leaders of technology, because ultimately this is a technological solution.
Doctor, I know you have so much more to share, and you have to come back. We're gonna have you on a panel on Friday. If I ask you to close with a message of hope, what would that be?
Well, I think, we can ultimately solve this crisis. We can ultimately solve the health crisis. We can ultimately solve our financial crisis, and we can ultimately solve our dental crisis. I think, I'm very positive for humanity. I think ultimately we will do the right thing.
So refreshing, Dr. Dominique. It was an honor. Thank you so much. And again, for the industry, for humankind, thank you. We need people like you to think ahead. And you present yourself to me the first time as, I'm a black sheep. You're not right. You just ahead of your time. And we need thinkers like you. Thank you so much. We're going to see you on Friday. And to everyone, please come and raise a question for Dr. Dominique. He's going to be there. He's going to be ready for you.
Thank you, Dr. Bach. Great to talk to you.